Back to school time is upon us, and the focus is on the kids. From one mom to the next, here are a few tips from my to-do list. Meet your child's teacher to start an open channel of communication and to put a face to the name. If possible, stop by the school with your kids before school starts. It's going to help lower their anxiety after being away all summer. Be sure to set up play dates with their classmates so they can refresh their relationships and you can reconnect with other moms. However, the one thing that needs to be at the top of your back-to-school list is you. When you take them in for their annual checkups, make an appointment for yourself. It's a great reminder that you need to be in shipshape as well. On today's show, the first line of defense for food allergies, innovations in shoulder replacements, and how some medication side effects might be harming your teeth. I'm Erica Vitrini. Access Health starts right now. It's one of the most common and costliest diseases, and if you're one of the estimated 26 million people with asthma, you probably already know there is no cure. But you can manage this chronic disease. Michelle Casalia of the Asthma and Allergy Foundation of America is here with some answers. Welcome back, Michelle. Always so good to have you here.
It's awesome to be here. Thank you.
So last time you were here, we talked about triggers. Now let's talk about symptoms. How do you know you have asthma?
Asthma is when your body's airways become inflamed. It makes it hard to breathe. Some of the signs and symptoms may be coughing, wheezing, a tightness in the chest.
Okay. So then how do you get diagnosed?
You want to go to your family doctor or your local allergist, and he'll do a family medical history. He'll do a full physical exam. He may take a lung function test.
Okay.
He may also do an x-ray of your sinuses and also your lungs.
So let's say you're diagnosed. Now, how do you manage that diagnosis?
Well, you want to make sure you know your triggers.
Okay.
You want to make sure you take the medication exactly how the doctor prescribed it. You want to be able to track your asthma so you know if it's getting worse.
That's smart. So I'm assuming an action plan is in order.
An asthma action plan is your best bet.
Okay.
You want to write down that asthma action plan. You want to share it with your friends and your families, and if you have children at school, you want to share it with the teachers and the school personnel. It's a great idea.
And I'm sure there's more information on your website.
The Asthma Allergy Foundation of America website has a complete asthma action plan form that you can use and take with you and print out.
So it's not the end of the world.
It's not. Asthma is a chronic illness, but it can be managed and you can live your life without limits.
Fantastic. Thank you, Michelle. And that website is aafa.org. And of course, you can always go to our website, accesshealth.tv. Michelle, we always love having you, full of such great information.
Thank you so much. Thanks for having me.
No problem. Coming up, could your prescription medication be negatively affecting your oral health? Stay with us. Did you know that our bodies produce up to 4 pints of saliva a day? According to the American Dental Association, chronic dry mouth decreases the quality of life for up to 20 to 30% of the people in the United States, and if left untreated, can cause serious dental and health problems. So what causes this condition? Who does it affect? And what can we do about it? Well, joining us today is Dr. Susan Cutler, Head of Medical Affairs at OraPharma. Welcome, Dr. Cutler.
Thank you so much for having me.
You know, often on this show, we talk about how the mouth is really a window to our general health. So can you tell us what exactly is dry mouth and what causes it?
Dry mouth, also known as xerostomia, is not a disease, but it's a condition. It can be a symptom of an underlying disease, such as diabetes, something called Sjogren's syndrome, which is an autoimmune disease that attacks the salivary glands, or it can be a result of over 500 medications, such as antihypertensive medications, anticholinergics, which are often used to treat Parkinson's, antihistamines, antidepressants, and not just patients with xerostomia, but patients undergoing cancer therapy and radiation therapy often have a dry mouth condition called oromucositis, which can be very uncomfortable and can actually affect 97 to 100% of the patients undergoing these treatments. Together, the patients with xerostomia and oromucositis need to let their doctors know that they are suffering from these conditions.
What are the symptoms? What do people complain about?
Well, they often complain of difficulty swallowing, difficulty eating, chewing, speaking. Some patients have extreme amounts of discomfort. They have bad breath. Other symptoms involve difficulty wearing dentures just because of the lack of saliva. Saliva is critically important. In fact, it's considered one of the most important biologic factors. It also helps to kill bacteria in the mouth. Saliva coats the gum tissue to lubricate, to allow the patients to swallow more easily. Patients who don't have saliva really have trouble functioning. In fact, they tend to drink a lot of water during the day because their mouth is so dry, which, for example, can make them get up in the middle of the night just to go to the bathroom. So it really does affect everyday life.
Well, what are the consequences of not having saliva?
If you look at what makes up saliva, it's calcium, phosphate, bicarbonate, sodium. Very simple ingredients, but calcium and phosphate are actually what teeth are made of. What we find is in patients that have dry mouth, they tend to have more decay. They have a lot of cavities.
Is that the acid that's getting to their teeth?
It's not just from the acid, but also the calcium and phosphate help to remineralize the teeth. And because patients aren't having debris and plaque washed away from their teeth, they have plaque accumulation, and that can often lead to halitosis or bad breath. In addition to that, patients find that they can be more prone to yeast infections in the mouth. So there are numerous sequelae that we see from having dry mouth.
Is there a solution when you have dry mouth?
Absolutely. There are many treatment options that are out there. The first thing, of course, is to make a diagnosis. We need to make sure that there's no underlying condition, systemic disease, causing the dry mouth.
Okay.
And if it's from a medication, I'm in no way suggesting that patients stop their medication. They should consult with their physician, find out possibly if there's another treatment option. But if not, there are remedies that can help patients. In addition to that, once we figure out why the patient has a dry mouth, there are many options for treatment. Some of the options involve prescription drugs. Sometimes it just may be an over-the-counter type of rinse. But let me tell you a little bit about NeutraSal. So NeutraSal supersaturated calcium phosphate rinse is a medical device that treats the symptoms and mimics saliva. It's not an anti-cavity rinse, but because it has calcium and phosphate, it does help to remineralize teeth. It also replaces the normal, what we call ionic balance, or the normal balance in the mouth. NeutraSal does not cure dry mouth, it doesn't prevent dry mouth, but it does mitigate the symptoms and provides relief. What these types of rinses do is it helps to bring the pH up or reduce the acidity in the mouth.
Okay, so again, you're not stimulating more saliva, you're mimicking it. Can you show me how that works exactly?
Absolutely. NeutraSal comes in these very easy to use packets, and what we do is dissolve the NeutraSal in 30 mLs or 1 ounce of water, any type of water.
And it's important to use just the right amount of water, right?
Yes, absolutely. We need to use the right amount of water and stir it until it's clear or nearly clear. And what's important is that the patient rinses with this within 15 seconds. And the way that it's used...
And why 15 seconds?
Well, it's super saturated, which means that the solution is packed with calcium and phosphate ions. And by mixing at the time of use, you're getting the maximum amount of calcium phosphate without it evaporating. And the way that the patient uses this is they rinse with half of the solution within 15 seconds, and they rinse for 1 minute and then spit out. And then they rinse the other half of the solution and spit out. And the only thing the patient has to do is not eat or drink for 15 minutes.
I've seen the pre-mixed dry mouth solutions. Are there benefits to having it in the powder form versus this pre-mixed solution?
By mixing it at the time of use, you are getting the benefits of supersaturation without evaporation of the calcium phosphate.
So I have to ask, doctor, though, are there any risks or side effects associated with it?
While the ingredients are recognized as safe, there is sodium, so that if someone is on a low salt diet, they should consult with their physician. It is a product to help to mitigate the painful symptoms of dry mouth.
Saliva, who knew? Doctor, thank you so much for giving us all this great information and providing us with real solutions.
Well, thank you so much for having me.
For more information on xerostomia, chronic dry mouth, and NeutraSal, go to NeutraSal.com. Or for more information, just log on to accesshealth.tv. Thank you. Here's some irony for you. The older we get, the more active we stay, and consequently, the more injuries we suffer. Here in Denver, Colorado, where staying active all year round is a way of life, Dr. Armodios Hatzidakis sees a vast variety of shoulder injuries. Why? It all starts with the fact that the shoulder is a very complicated part of our anatomy.
Three of the main causes of shoulder pain that I see are trauma, when someone hurts themselves, rotator cuff problems, when the main muscle complex inside the shoulder joint becomes pathologic. The last main issue with the shoulder is shoulder arthritis. Shoulder arthritis occurs when the normal cartilage that lines the shoulder joint starts to break down. You need cartilage in your joint to make a slick gliding surface for any joint to move. And then when that cartilage breaks down, the conditions in the shoulder becomes worse for the movement, and that can cause a lot of pain. It can cause cracking, grinding, inability to sleep at night, inability to lift the arm as far as you'd like. Sometimes the stiffness is very severe, and it can become very painful and disabling to patients.
It was over the past 4 or 5 years I started experiencing initially, some infrequent pain in my shoulder, which was limiting as far as my motion at night. I would feel pain at night, and over the years it certainly progressed to the point where it was difficult to sleep at night, particularly on my right shoulder. And the activities that I enjoyed so much, like golf, even riding my bicycle, even skiing for that matter, were really difficult to do. It was dull, but it was always present. So it was really sort of a depressing sort of pain that you always had to live with. All you think about is the pain in your shoulder.
Chronic shoulder pain and shoulder injuries are known within orthopedic medicine to be, in one word, challenging.
When the shoulder becomes severely arthritic and the patient cannot live with the shoulder pain or dysfunction any longer, there's an operative intervention that can help, which is called a total shoulder arthroplasty or total shoulder replacement. The total part means that both the ball and the socket are relined or resurfaced with metal and plastic components typically. In the beginning, we had long stems that went down into the marrow of the bone. The complications of having a long stem in your bone, either having a trauma to the shoulder where the arm bone can break around the prosthesis, or when the shoulder had to be redone, where it's very difficult to revise or change that long stem because it's so well fixed and going so long down the arm. Sometimes you have to make an incision all the way down the arm to make a cut in the bone just to get the stem out, to change it out if you need to. The other downside of having a long stem into the bone is that the force gets transmitted to the arm bone itself and isn't back in the shoulder where it belongs. So if the force gets taken away from this part of the bone, sometimes the bone can start to go away.
Experts say these complications can happen to any patient. But for younger people, traditional shoulder surgeries potentially could lead to less favorable outcomes.
It's potentially advantageous in young patients to use a less invasive technique. You're going to have an implant that shares the load better with the bone. You won't lose as much bone over time. You'll have more bone stock to change to a different prosthesis if you need to. So in general, in orthopedics, we try to do less in the beginning so that you have more options down the road. The nice thing about better technology to do better shoulder replacements is that it doesn't necessarily just apply to very young people. It really just applies to anybody that has good bone.
In March of 2015, the first FDA-cleared canal-sparing device was introduced to orthopedic surgeons like Dr. Hatzidakis. The small prosthetic device called Simpliciti is now being used with success and with no increase in risk compared to stem devices.
Dr. Hatzidakis spent some time with me before surgery when I was in his office discussing what the options were, and he mentioned that there was a new device that was available that he felt was a good option.
The benefits of the Simpliciti prosthesis to me is that it provides a great prosthesis to create an anatomic reconstruction of the ball of the shoulder, the proximal humerus. It has good fixation into bone as long as the quality of the bone is good, and it potentially loads the bone in a more physiologic or natural way as compared to a large stem.
My recovery went very, very well. From a standpoint of just pain in general, I had almost none. I mean, after surgery, yes, for a day or two, but honestly, from that point forward, it was minimal at most.
I can say for the last year, as I've been implanting the Simpliciti prosthesis, I've not seen an increase in complications. I've not seen an increase in loosening or failure of the device. The patients have done exceedingly well.
My life changed, I mean, 100% for the better when I had my shoulder replaced. I pretty much do whatever I need to do on a daily basis. You know, I mean, if I need to reach above my head or I need to reach behind my back to scratch an itch or whatever it is, I can play golf, you know, I can ride my bike. I can do all of that without any limitations whatsoever.
The patients have done very well. The patient's been pleased with the result, and I've been happy with their post-surgical course. I almost have to keep them down. They want to do too much too fast.
Before I had my surgery, we had a granddaughter, and it was almost impossible to lift her up. After surgery, she's almost a year old now, and I have no problems lifting her up, lifting her above my head, and it's very gratifying to be able to do that.
For more information about Tornier Simpliciti shoulder system, go to liftmyarm.com or just log on to accesshealth.tv.
Hi, I'm Michelle Strange, your registered dental hygienist, here with some tips and tricks. A lot of times patients ask me when the best time to brush is. I try to remind them not to brush right after you eat. Every time you eat, it actually drops the pH level in your mouth. So you really don't want to scrub those acids into your teeth when you're brushing. Wait about 20 minutes and then you can go brush your teeth. The other thing is, if you're sipping on drinks throughout the day, other than water of course, sodas, coffees, any kind of juices, that is going to lower your pH level every time you take a sip. So you're constantly in a low level of acid in your mouth all day long. So rinse your mouth out with some water or drink it all at once. And remember, healthy habits equal healthy smiles.
If you have children in school, there are extra concerns for parents of those affected by food allergies. Returning to the show with more tips on this is Michelle Casalia of the Asthma and Allergy Foundation of America. Welcome back, Michelle.
Thanks for having me.
So it's got to be really nerve-wracking for parents who have kids going to school for the first time. They lose all control if their kids have allergies.
It's the hardest time of the year. It's so stressful for the moms and dads, especially if you're sending your child to school for the very first time. Not only are you worried about what you're going to feed your child, but you're also worried about what the others are going to eat. For example, you know, if they're eating the peanut butter, you don't want your child who may be allergic to peanut butter to touch it, which might result to hives, or even worse, if they put it in their nose, in their eyes, or their mouth, it can have a severe reaction.
Absolutely, especially for the really young ones. The old ones sometimes have a better sense, but the young ones just don't. What are some of the signs that your child might be experiencing an allergic reaction?
Some of those signs may be hives, swelling of the lips, vomiting, diarrhea.
So if you see any of this, what should be your first line of defense?
First line of defense, people tend to reach for that over-the-counter allergy medicine. No. The first line of defense should always be an epinephrine auto-injector. And it's a good idea to always have two.
So should we always have an action plan?
Absolutely. It's a great idea before even school starts to sit down with the school personnel, the teachers, the nurses, the gym teacher, and communicate your concerns and prepare ahead of time. And if you go to the Kids with Food Allergy website, we have a drop-down menu, and it explains detail by detail exactly how to plan and prepare and to make you feel confident as a mother or a father to send your child off to school.
It's all about education, not just your children, but everyone who's caring for your children. And that website is kidswithfoodallergies.org. And of course, you can also go to our website, accesshealth.tv. Thank you, Michelle, for coming. It's so good to have you, as always.
Great.
It's so easy for parents to get overwhelmed during the school year. So how do we keep calm and hold it all together? Look, I'm no expert, but I have lots of experience, and what I've found that works best is lots of prep. You prep the lunches, the outfits, the book bags, anything that will make getting out the door easier to do. And get the kids involved. That way, the older they get, the easier it is for them to pitch in and help out. How do you like that? For more back-to-school tips, visit us at accesshealth.tv. See you next time.